Hi, short little share here for my under 50 crowd, or those out there who are under 50 and want to file for Social Security disability or SSI because they find that they can no longer do their job and they had to stop working full time. You need to know that the definition of disabled is, in a roundabout way, when you file a claim, you're asserting that you believe you are unable to perform the required task for every single occupation in the national or regional economy that exists in substantial numbers, every single one. So you're not just saying that you can't do your prior job. I mean, that may be what you thought you were saying, but that is not the standard. You have to prove that you can't do any job. Social Security disability and the way it is priced and taxed is not meant to cover everyone who can't do their occupation they went to college for or trained for. It is the safety net for the kind of situation when you can't do any job full time. And you also can't be earning too much part time. So that's a whole nother little factor. But it's not just about your old job. It's about every other job that exists in substantial numbers in the economy. So they're going to be looking at you and your medical records to see if there's enough in there that shows that you have such disabilities to one or more body parts or mentally that would prevent all jobs. You probably don't even know what the vocational requirements are for all occupations. Nobody does. Well, maybe even the vocational experts have to look it up, right? I mean, there's 12,000 occupations out there. So everyone gets, I look at it this way. We all come to the field with the presumption that we are unimpaired. Okay. So I always describe it as this. Whatever you have going on with you, each body part, think about, does it work like it did when you were 20? And people say, well, I'm 48 now. That's right. So probably you don't. So with every single body part that is not like it was when you were 20, that's probably something you should get checked out. So there can be confirmation that it is not like it was when you were 20, because there has to be a basis upon which to find that you cannot use that body part for a particular functional task that is part of the SSA laws on a constant basis in an 8-hour day. So assume that you're considered a rosy perfect person from a capacity to engage in tasks person, and start going down the line. If that means you have never gone to a hand doctor, but you have hand arthritis and you know you can't grip something for 8 hours a day, or whatever the other problem may be with them. It could be swelling, it could be numbness and tingling where you actually drop things, or you can't pick up things or reliably. If it hasn't bothered you before because you never actually have to do that, that doesn't matter. Go get your follow-up. And when I say follow-up, I don't mean a one-hit wonder. I mean, keep pursuing it, generally speaking. And you would talk to your lawyer about how much. But there are therapies, and you're trying to, this is for the purpose of evidence for your claim. This is not in any way giving you medical advice, because I'm not saying any conservative therapist will necessarily help anyone in any particular situation, but they provide the evidence where it is seen that there is a problem. You are complaining about a problem. It's not a one-time problem, because remember, Social Security has a 12-month durational requirement. So you need to keep pursuing. And if there are no treatments and you're staying on one and nothing's changed, you continue with that follow-up so that at your next appointment, it is shown that nothing has changed. There is no improvement. Nothing being treated, or big gaps in time without treatment, can lead to the presumption that all is well, regardless of what you say, because our actions tend to speak more loudly than our words when it comes to things we have a motivation to say. So you want to make sure your actions or your inactions do not contradict what you claim. If you have bad hands, which by the way, might take away some or all of those jobs that require bilateral manual dexterity, if you have bad hands, you need to pursue it. Just because it doesn't bother you in your home life or didn't bother you at your old job because you didn't really have to use your hands, you have to prove a bunch of other jobs now, a ton of other occupations that you can't do. And those hands are going to carve out some of those. So that's one piece of advice in terms of, and this would apply to older than 52, but absolutely for younger people. The joke around the neighborhood is that if you're under 50 and you're not bedridden or in a wheelchair, you will not prevail on Social Security disability. It's not entirely true, although it's not entirely far off the mark either. It is a huge mountain. It is very hard to prove that you can't do anything sedentary, easy, and unskilled with no training required that a sixth grader could do it on a full-time basis. When people have pain problems, back problems, leg problems, arm problems, they will still generally give them usually light work as a qualification. Sometimes sedentary, but that still means you can do, there's thousands of jobs that you could still do. So you need to focus on those other body parts, because getting down to less than sedentary is probably not going to work for you. There are rare cases, but if you think that your case is going to rely on that, you're probably wrong. When it comes to a mental health case, particularly if your case is only mental health, the rumor around the block is always, if that person is not psychiatrically admitted semi-long term, like a month, twice a year, maybe once a year sometimes, but other times twice a year, for the last few to several years, you're probably going to be categorized as, yes, very impaired. Yeah, definitely impairments there and limitations. In fact, so limited that that person can only be expected to perform an unskilled job with simple 1-2 step directions, perhaps no interaction with the public, limited interaction with coworkers and supervisors. So again, just regular therapy, which, by the way, oftentimes the therapists are not willing to divulge the record, so that kind of sticks it to you even more. On this issue for another day, garden variety depression anxiety is not going to win you disability. Okay, it probably garden variety in and itself would not win for anybody, regardless of age, but certainly not for a person under 50. I take cases where there isn't always the hospitalizations. I look at a variety of things, and I do go out on a limb and take a little risk with these cases, because I do think that if someone knows, and if I get a strong feeling that someone is not going to be able to sustain a job for months on end, given their mental challenges, I'm going to try to move heaven and earth to prove that. So the next best thing to psychiatric admissions, which if someone is really serious and needs to be stabilized, that's kind of what shows that they needed to be stabilized. Medications, intensive outpatient, 5 days a week, 5 half days a week. If they're seeing probably a psychiatrist along with a therapist, a lot of times psychiatrists are only every 3 months for medications management. Just not a lot of verbiage there. There's not a lot of discussion on decompensations and interim challenges that would be inconsistent with being able to hold on a full-time job on a sustained basis. So you have to be aggressive. You have to make all of your impairments and getting treated for them. If there's no treatment of change that needs to be going on because you're at the top level of that, then it's follow-up. It's regularly following up with that provider so that evidence is created that you still have that problem and at what severe level. Okay. Sometimes it might, there can be insurance changes. You might have to change doctors. That's okay. Better to have a doctor and a good one than no doctor at all. Sometimes, nowadays it's physician's assistants and nurse practitioners that are standing in the shoes of the doctors. That's fine. SSA has started to recognize that. I hate the term more is better, but it almost is when it comes to Social Security disability. If you have the problem, even if you consider it minor, given what your daily needs don't include, it could be included. It could be important because of what it would, what impact it would have on your ability to do one of those 12,000 occupations out there that they're relying on. Okay. So under 50, you've got your work cut out for you. I think a good expectation is that it may be a marathon and not a sprint. Sometimes it is best if you have a claim, and depending on a bunch of attendant circumstances, and you're heading to hearing and you know your case is not going to meet the threshold necessary yet, maybe you just started treating and don't have more than 6 months of treatment, might be sometimes withdrawing the request for hearing is a really good idea. A lot of things have to be taken into consideration. I won't go into that here. That's a video for another day, but that is always an option if it means restarting it with a little bit more stronger foundation, maybe some better advice. If you've been self-representing, you're almost invariably going to probably not make your case as strong as it could be. So hang in there. I sympathize with younger people who become so impaired that they're disabled. And I know they're out there. I represent a lot of them, probably more than my fair share, because everyone deserves a chance to prove what they're saying about why they can't do what they can't do. So get some good advice and follow it and be diligent. Make treatment and follow up your full-time job. That's like a deal breaker if you don't. So anyway, have a wonderful Thanksgiving 2022, and I'll see you after the holidays. Bye.